Hey, Health from Within family and our Fearless Immunity Workshop Series VIP group. I'm so glad you guys are tuning in tonight. I hope you guys are still awake. I know with the gloomy weather earlier, may have hit the bed early. I know it was a relaxing afternoon evening for me, so I get it. But I'm glad we're here. I'm excited about this week this workshop is because it's all about the central nervous system. Man, a lot of this information you may have read around the office, but we're going to take it to the next level when it comes to your brain, your spinal cord, your central nervous system, the health of your spine, the health of your joints, ligaments, tendons, disc spaces. And what's even more exciting tonight is I have a couple props, which is crazy. Some of these props are the things that when I first heard about how vital the immune system was and how important the central nervous system is and how to really understand it as a student, but also how to deliver the message in a clear, concise way to the community patients. There was a couple different things that were used to teach me, and I'm just going to go over them really quick. One's going to be a rubber band, so I'm going to go over how in the world does this apply to central nervous system. We're going to go over that tonight. We're going to go over the weight of a dime, how that applies to your central nervous system. So we'll be using that as a prop. This one's probably pretty easy for you guys to understand. It is definitely organic banana. So we'll be explaining how and why that applies to the central nervous system. And so we're going to go over some good information tonight, guys. And, over the last couple of workshops, we've covered a lot of information, a lot of details, a lot of things, action steps that you can be doing. Well, we're going to cover that a lot tonight. The biggest action steps is that you get your spine checked and adjusted for the rest of your life. You do your spinal rehab for the rest of your life. The people you love and care about most, who are closest to you, get their spines checked and they get their spine taken care of for the rest of their life. Those are the biggest action steps out of tonight, right? If you fell off track on your rehab, it's okay. But we got to get back on track with that. If you missed some appointments, make up some appointments. If you didn't know how vital it is to get your kids checked, get their spines checked, right? They'll thank you for it when they get older, I promise. But we're going to go over the why, not just the how to tonight. And so I want you guys to understand that. And really right now, as a profession, as a chiropractic profession, we are, not just us, but any really healthcare practitioner who's standing up to go against, let's just call it the medical system and the medical model, are coming under attack. Medical doctors themselves are coming under attack when they say, well, maybe the vaccine for COVID isn't as safe as they thought, or wait, hold on, we're diagnosing flu virus with COVID to get more money. And some of these medical doctors are literally losing their license right now. And so I think we have to recognize that we are legitimate under attack, and our patients are maybe not be experiencing the attack, but you're the weird one right now. And I think that will be continuing to be the pattern as we move forward in life when it comes to our health, because the weird one gets the best results. And if we're going to get results in our health, no better way to do it than doing it on our own time and understanding how amazing the healing potential is in the body. And so I will tell you that right off the bat, what's the difference between a dead body and a live body? A freshly dead body has blood flow in it still. It has every single organ in it. But what happens if you cut a fresh cadaver's leg? That cut will not heal. If you cut my leg or your leg, that cut will heal. The difference is life. The difference is life. It is the brain, right? So it's not when the heart stops, it's when the brain stops. So when your brain stops, you stop, right? So we know this is vital. I mean, the guillotine has worked 100% of the time over the past thousands of years, right? And, in Hollywood, they say, well, the heart monitors stop at flatline, the heart monitor, but it's actually not just the heart monitor that they watch, it's the brain waves. They monitor the brain waves, because if the brain stops, everything's going to stop in milliseconds. And so, listen, the central nervous system controls not only the biophysiology of your body, right, of what you feel and the chemistry, but the psychology of your body. And that it's a two-way system. On the wall in our adjusting area, we say above, down, inside out. Above, down, inside out, spiritually, emotionally, physiologically. But also there's a two-way system to where, well, hold on, wait, the body also communicates with the brain. So there's a brain body connection. There's also the body brain connection, right? So if your stomach is not functioning, it's going to tell your brain, hey, something's not right, right? If you hurt your knee, it's not wireless. You're not Bluetooth, right? The knee is going to create endorphins and some type of hormone that's going to influence your brain chemistry, right? To say, well, maybe I shouldn't walk on my right knee, right? And so there's this two-way system, and it's miraculous. And so literally within 18 days of conception in the womb is when the brain and the spinal cord are formed. Within 18 days, and it's by 4 weeks you can hear the heart rate, right? So many moms and dads, they're thinking, well, the heart, I heard the heart rate, that's amazing. But for me, I'm thinking within the first 10 to 18 days of conception, the brain and spinal cord are already forming. And what's amazing is there's bundles of nerves that come off of the spinal cord, almost like roots of a tree. Okay, roots of a tree. And what happens is these bundles of nerves continue to blossom. Actually, in medical research, they actually use the word blossom. Organs will blossom off the central nervous system, off the spinal cord. Therefore, that blossoming of the nerves turns into a specific organ attached to a specific side of the spinal cord that will continue to be connected for the rest of that fetus's life, starting from 18 days of conception. That is a miracle, right? That is a miracle. And so literally the nerve roots turn into organs. It's absolutely miraculous. I mean, it's incredible. And so listen, guys, I mean, this central nervous system is powerful. It is, when I say the best doctor in the world is inside of you, this is what it is. It's the central nervous system. God gave us that to function, to live our life through, to be connected to the world through our central nervous system. So literally, man the spiritual, God connected man the physical through the central nervous system. I mean, it's amazing. And I think it's overlooked, unfortunately, in our culture, just because we don't see our bad posture until it's, wait for it, bad, right? And so, to me, I think it doesn't get enough credit. It doesn't get enough credit unless you've been to an office like ours, and unless you've seen the amazing healing potential released in your body, and whether it's you feel better, whether it's you're off medication, whether it's you've lost weight, maybe you don't have pain anymore, right? Whatever it is, it's way more than pain, though. It's about health and function. See, to heal means your body must be healing and functioning at 100%. It's not the lack of sickness, symptoms, or disease, right? It's not the lack of sickness, symptoms, or disease. So it's not about pain and headaches. I don't want that for you. I don't want that for people you love. It's not about heart disease, cancer, diabetes. It's not about antidepressants, getting off antidepressants. It's not about treating a symptom, sickness, or disease. It's really not about that, right? Do I want that for you? Absolutely, right? We want people to be drug-free and feel and heal amazing. We want that for you. But really the answer is health. That healing comes from above, down, inside out. So when I say healing, you're healing or power's on, that power is coming from within your brain, sending signals down your spinal cord, across the nerve roots, that branch out to every single cell, tissue, organ in your body. Guys, we haven't even talked about the spine yet. We're just talking about health and healing at this point. We're talking about the amazing electrical signals that travel from the brain to the body at 100%. And so I'm going to go over a health and sickness continuum. Okay. Sorry for my handwriting here, but if you guys have to get this out, do this and get this out with me. So on a piece of paper, I got 0% on one side. I got 100% on the other side. 0% is 0% health, which means death. 100% is 100% health and healing, right? And by the way, we'll never be fully at 100%, but our goal is to get as close as we possibly can to 100% for as long as we possibly can be, right? That's called grace, right? But in our world, a fallen world, life, stress, you name it, listen, our goal is to get as close to 100% for as long as we possibly can, right? So what happens is this is what's amazing, right? Healing means to heal, right? Heal. So Heal. Health means to heal. So watch this though. in order for us to actually feel our first symptom, our tissues or organ systems, a specific organ system, has to be dysfunctioning by 40%. Okay. So we have to be at 60% function of those tissues. Let's just take, for instance, low back pain. Okay. So for you to have low back pain, the tissues in your lower back have to be dysfunctioning by 40%, meaning they have to be at 60% function for us to feel anything. So from 100 to 60, I call that fine, right? That's the fine area. That's the guy who says, I'm fine. It's not that bad. It's not that bad that often. It's my age. It's my genes. It's not that big of a deal. It's not that big of a deal. It's not that big of a deal, right? Then watch this. Then we hit 60, right? 60%, not 60 years old, okay? 60%. And then this is I say, from about 50 to 60%, this is called our OTC area, okay? Our over-the-counter area, okay? Over-the-counter area. That's people that say, well, I got a lot to do and I don't want to slow down, so I'm just going to take medication. And guess what? The medication actually, wait for it, it actually works because you actually feel better, right? But what happens is the dysfunction is still there. So now you have false hope. So now are you going towards 100% health, or are you continuing to move faster actually towards 0% health, sickness and disease and death, right? We're moving towards what? Less than 60%. We're moving towards 0%, right? And so this is where a lot of Americans live, between this area right here, from 40 to 60% function. And we think it's our age and our genes. A lot of people don't even want to get up to here, because what happens when they start to feel good? Well, I'm just going to go right back to right here. Oh, I feel bad. Oh, man, I guess I have to go back here. I feel good. I'm going to feel bad again. Oh, man, I got to go back over here. It's like that weight loss thing, right? Or it's like, let's just use this as a weight loss pendulum, right? Well, I gained too much weight over the holidays here, so I'm a 60% function. So I'm going to go really try to eat healthy and exercise. I look at, oh, I got to go back here because the holidays are coming back again. So there's this yo-yo factor that happens. And unfortunately, people aren't even using natural remedies to try to heal. They're using over-the-counter medication, prescription medications, and it's sad. It's sad. And so remember this 0 to 100%, that if you're at 60%, your body's saying, hey, man, something's not right. Let's fix it out, figure it out. If we look for the cause of the problem, if we get to the cause of the problem, then we will move closer to 100%, and we will stay in this 80 to 100% range for the rest of our life, and you'll be the healthiest person on the planet. And so I just want to remind you that this healthcare pendulum, or this wellness and illness graph, is really, I don't want to dumb it down and speak in elementary terms, but it's factual too. So, by the time we have heart disease, cancer, diabetes, blood pressure, headaches, we just say, oh, well, I guess I'll have it forever and we're not going to change. But since it's a pendulum, right? Since it's a graph, you can always change it with time. You can always change it with time, right? And so the thing is, when we're looking for the cause of the problem, we're not going to throw a pill, potion, or lotion at it, right? We're just not. See, unfortunately, in our culture, we say, well, here's an over-the-counter medication. It's really easy to do. Just do it. Here's a prescription medication. It's really easy. Just take it. But we do that in a health food store too, where, hey, I have X, Y, or Z symptom. I just need to take this for that. It's really easy to get into that rat race, and we don't want you to. We don't want to, right? And so understand that if we look for the cause of the problem, and a lot of times it comes back to the nervous system, then we're going to honor the body innately. We don't want to trick the body, because when we try to trick the body, usually it's human nature. We want it on our terms and our time. It just doesn't work that way. And dysfunction over time in the nervous system turns into dis-ease. Dysfunction turns into dis-ease, right? And so we gotta step back and say, listen, what are we doing to our central nervous system that could cause dysfunction, which then in turn causes dis-ease? And what we do, and what you're doing when you're in our clinic, is we're taking the best care possible that we can of our spine, because our spine has to be in proper position in order for the signals from the brain to get to the body at 100%. For there to be the least amount of pressure in the spinal cord, the spine has to be in a specific position. not in a normal position or a common, but actually they use the word ideal position of the spine, causes ideal function of the body, causes health and healing. Not just maybe here's a variation of what the spine should look like. No. This is the ideal position of the spine, allowing the body to heal and function optimally to avoid and prevent sickness and disease. And so if we think about what the spine should look like, right now, I'm going to switch over to this screen here so we can take a look at some of these pictures that I got pulled up here. It's going to be good. You guys with me? Awesome. Great. All right, I'm going to disappear for 1 second. Okay. So the spine controls everything. You guys know that. Now you've seen this in every room in our health center, in the adjusting bay. So look at, these are the bundles of the nerves that turn into the specific organs. So from the side in the spine, you have to have these 3 45-degree curves from the side. You have to have these curves, okay? You have to. It's not Dr. Nick research, it's medical research, okay? And what happens is that these nerves that come out of the upper part of the neck, they affect the eyes, ears, nose, throat, facial muscles, jaw muscles, right? Chest, heart, lungs, affecting allergies, dizziness, brain chemistry, moods, sleeping patterns, thyroid gland. It affects the upper stomach too. So it really starts to impact the acidity levels that in the stomach. The mid back really impacts everything in the mid torso, from right around the chest, almost down to the belly button there. So you got the pancreas, you got the liver, you got the gallbladder, even the kidneys start to be impacted by the mid back. Lower back impacts everything from the stomach down. So you're going to get the lower colon, reproductive organs. You're going to get the bladder and prostate for men, uterus, ovaries, adrenal glands come from the lower part of the back. And so we must have these 3 45-degree curves there. And this is what I want you to remember, is because when the curves are in proper position of the spine, it allows the spinal cord to have no neural tension, okay? So no neurotension or neural tension, Neural tension. So that means there's no tension on this actual spinal cord itself when the curves are there. But if the curves are lost, starting from potentially the birth process, and the spine is straightened out over time, that actually puts more neural tension on the spinal cord, and it causes the diameter of the spinal cord to actually flatten or shrink. So watch this, though. Watch this as we go a little bit lower. Watch this. So look at the spine here from the back. You guys know the spine should be straight up and down from the back. Our hips must be even. Our spine must be straight up and down. Once again, here's the 3 curves we just talked about. This is at a different angle, so you can see the sides of the joints and how intricate they are, and how everyone has an ideal spinal position, which is perfect. But watch this top bone right here, okay? This top bone right here, and the top bone right here, and then once again, the top bone right here. This is what they call the atlas, ATLAS, ATLAS. The atlas is a bone that is so specific and special to our spine, because that is where the brainstem sits, right there. The brainstem. Now, the brainstem is the bottom portion of the brain, and it literally falls into the top 1 to 2, 3 bones of the spine. So even down into C2, right? So C1 is the atlas, C2 is the axis right here, C2 is the axis. And what happens is the brainstem falls into these top 2 bones here. And when there's rotation in the spine, or let's say we've lost the curvature in the neck and it starts to straighten out this way, that brainstem starts to have crushing pressure on it. And when there's pressure on the brainstem, the number one thing it does, now remember this, throws us into a fight or flight state. High blood pressure, sleep problems, anxiety, inner ear problems, immune system issues, focusing problems, ADHD, asthma, allergies, right? Depression, right? All comes back to this top part of the neck. Gut issues that you can't digest food, right? All comes back to this diabetes, blood sugar, lower metabolism, all comes to the top part of the neck, right? So remember, atlas is the top bone of the neck. Some doctors, actually, all they treat is the atlas. They'll just adjust one bone and they say power's on. And it's just a different philosophical belief. See, we believe that every bone and subluxation pattern along the spine should be addressed and corrected, including, of course, the top part of the neck, because that changes the brain chemistry and changes the brainstem for the rest of the spine, right? Now, not on a diagram view, this is the atlas. The top bone in the neck right here is the atlas. Second bone is the axis. And the brainstem, the lower part of the brain, falls right into these two bones right here, okay, on the back end, okay? And what happens is this, is when this curvature is in the right position, there's the least amount of tension on the brainstem. If this has gone forward, this is shifted forward, or you've lost this curvature of 45 degrees down to 0 degrees, it puts more crushing pressure on the brainstem. Therefore, it causes a slew of different health problems, right? And so that's my my teaching moment of the day. I'm gonna get back to the screen here, okay? So thanks for not falling asleep on me on that one. So that's good. But let's take a second and say, okay, well, can broccoli fix a spine? I know some of you are laughing right now. No. Can a supplement fix your spine? No. Can a supplement take pressure off of your brainstem? Absolutely not. Absolutely not. And this is an information superhighway within your spinal column and cord, right? And some people are like, well, I didn't know we had to have curves. I just thought people could have a straight up and down spine from the side. Well, that's just not the case, right? It's just not the case. And so if we think about how important the brainstem is, I mean, let's take this banana, for instance. You know, I don't know the science behind why a banana is nearly at a 45-degree curvature and our neck has to be too. Like, I have no idea. I honestly don't know. But this is what I'll tell you is that if I were to straighten this banana out, right, it just doesn't work. You see? For some reason, it has to be at 45 degrees or else it what? Breaks and smushes and gets crushed on the inside, right? It just doesn't work when it's not at a 30 to 45 degree angle. And so what happens is it gets smushed on the inside, starts to break, starts to crack on both sides, mind you, right? And we just think, well, our spine can just be straight if we want. Yes, that's a banana, an organic banana. Remember, organic, right? That's a banana, has to be a certain way so it doesn't break. So the engineering that God put in our body and our spine allows for our spine to be at 45-degree curves. Why? Because those 3 45-degree curves act as a spring in our spine, and then they compress and they expand. I mean, look at most bridges out there. Some of the biggest and tallest structures in the world, it's made of arches, right? It's made of arches because it dissipates the weight and the tensile forces evenly, so there's no compromise in, for instance, a specific bridge or specific what? An arch, right? Right? And so what happens is it uses the angles to strengthen itself. So does our spine. Miraculous, right? And so, guys, I just want to tell you that with the central nervous system, how important it is, and how sympathetic and parasympathetics and how they all work together. I mean, the sympathetic nervous system is the overdrive. It's the fight or flight, right? It's I'm being chased by a bear. Oh no, right? And then you got the parasympathetic nervous system. So the number one pattern that I see, if there's damage in the spine, it's going to throw you into a sympathetic overdrive continuously, right? So if the neck's damage or the lower back's damage, you're going to be in a fight or flight state. When we adjust you, we get you into a parasympathetic state. Digestion improves, blood pressure comes down, blood sugar comes down, sleep patterns improve, you feel better, pain receptors start to reduce, right? But what happens is that when there's an imbalance within the central nervous system, literally it hijacks your physiology. It hijacks your physiology. And so we see this a lot with loss of cervical curves. So if you've lost the curvature, you're in a fight or flight state all the time. And guess who has a lot of loss of curves? Teenage girls, teenagers in general, I mean, are going to have a lot of lost curvature because they're sitting a lot, they're on their phone a lot, they're on their iPad a lot, they're on whatever a lot, but they're not moving, right? They're sitting a lot. And schools are making this worse right now. And so we know sitting is to the spine is like sugar to teeth, right? And so we got to remember that, listen, we have to take care of our spine, right? We have to take care of our spine. And just a reminder on how important the brainstem is. Who remembers Superman, Christopher Reeves, right? Many people thought that he severed his spinal cord after he fell off his horse, but that's actually not true. It's his top bone in his neck went into his spinal cord about half of the width of my pinky, about half the width of it, right? Not like this, but actually like this, half the width of it. And it damaged the spinal cord so much that everything shut down, right? His lungs shut down, his heart shut down. He could never go to the bathroom without help ever again. I mean, everything shut down, and he aged so rapidly, right? And what I'll tell you is, of course, that's a drastic example, but when we see 9 out of 10 headache issues come from the upper neck, right? From the atlas area. And so this imbalance in the central nervous system affects our hormones, blood pressure. It affects our sleep patterns, right? Everything, right? And so why do we get adjusted for the rest of our life? Is because we have to make sure we maintain our spinal cord and our spinal column. Guys, the first time we ever get our spine checked is that time when we're in middle school, when we get checked for scoliosis. And we're told, pass the test, you don't ever have to get your spine checked again for the rest of your life. It doesn't make sense at all. But if you don't pass the test, you're referred to a surgeon, and they recommend surgery or bracing. But that's the first and sometimes the last time we ever get our spine checked. And so, you guys, I just want to acknowledge you for taking care of your spine, and taking care of your health, from the inside out. And guys, I mean, getting back to the atlas, I mean, just so you know how amazing this is that the atlas, the from a bird's eye view, the atlas is there's a hole. It's about this big. The spinal cord goes through. Okay, and the spinal cord fills up the atlas by about 75%. Okay, so it's your spinal cord, your brainstem is thick at the top, and it narrows towards the bottom, right? And what happens is it's almost like a kink in the hose, right? To where if there's pressure there, we don't say I'm walking around and, oh, my brainstem has pressure on it. We don't say that, but that's exactly what's happening, actually. And what's interesting is that just the weight of a dime on your spinal cord or your nerves, just the weight of a dime on your spinal cord or your nerves, I want you to remember this, can reduce the function of that nerve root or that part of the spinal column by 40%. I'll say it again. Just the weight of a dime on a specific nerve root and or spinal cord portion of spinal cord can reduce the nerve function by 40% if left there. This is the key. If left there. Why is that key? And I want you guys to either do this now or another time, but I'm gonna put this dime in my hand, okay? And at first, you notice that something's in your hand, right? You notice that you're holding something. You notice that there's something there. It's light, right? So it's not heavy. It's light. But the longer that it stays in your hand, and maybe you're distracted, you're doing something else, but the longer it stays in your hand, what happens? You actually don't feel that weight anymore, right? And what happens is that the loop from your brain to where that sensation is starts to dull. And so at first you may say, I got a dime in my hand. I see it, I feel it, I notice it. But then over time, the brain starts to lighten that signal, right? And what happens is that you don't know you're holding it after a while. And unfortunately in our health, we do that a lot, right? I had leg pain. It was really bad. And now I don't even know if I have it anymore. Maybe I just think I'm used to it. It's that new normal, right? So that's one example, okay? But what's incredible is that when you get your spine adjusted in the upper neck, the atlas, okay, when you get adjusted, there's blood vessels that travel through your spine, okay, especially the top few 4 bones. There's blood vessels that go to the top to your skull, okay, through the top 4 bones. And what happens when you get adjusted, research shows that there's a 33% better blood flow to your brain after an adjustment. It's incredible. Why? Is because the blood flow can actually go to your brain because there's no subluxation, there's no misalignment, there's no pressure on the brainstem, there's no pressure on the atlas, on the blood vessels from the atlas. So boom, get adjusted, 33% better blood flow to the brain on average, by the way, on average. Okay. And what happens in our culture is that if you have a sore neck or there's a spasm in your back, we say, well, not we, the culture says, well, take a muscle relaxer. Do you guys realize that innately your body may be creating a spasm to protect the joint so you don't further harm it? And what we're doing is we're saying, well, here's an injector. Here, you can inject something in there. You can put steroids in there, which actually, by the way, medical research actually shows it makes arthritis worse over time. And what we do is we say, well, here's some ointment, here's some cream. Let's try to get those muscle spasms down, when really maybe your body actually needs those to protect you. Just maybe, right? And I would say this, whenever people come into our clinic who say, I have arthritis, the doctor said I have degenerative joint disease. Well, do you know why they've named it disease? It's because now they can actually diagnose it and bill it to insurance, and insurance will pay for drugs and injectables. I mean, it's so sad, right? It's so sad, but that's what's happened. When people say, well, I have degenerative joint disease, the doctor told me I have it. Well, they diagnosed you because the insurance company made them so that they would actually pay the doctor for steroid injections or drugs. It's just absolutely insane to me. But guys, I'll tell you that if the spine is not moving properly, arthritis will start to show up for multiple reasons, but we're talking about biomechanically right now. There's something called Wolff's Law. You can Google this if you want, do some research. Wolff's Law says that if there's uneven stress and pressure in your spine, or really any joint in the body, but we're talking about the spine right now, in the spine, when there's any uneven stress or pressure, it will cause damage to joints to unevenly wear over time, causing a breakdown in tissues, ligaments, and tendons. So think about this. What do most medical doctors do, or the medical system says? They will, well, you have arthritis, it's just your age. That's not actually accurate, because every joint in your spine is the same age, by the way, right? It's not just, oh, well, you have arthritis there because you just have age. Even if you went to a mechanic with your car and there was weird wear and tear on a certain tire, or this tire is wearing out way faster and abnormally than the others, he wouldn't be like, well, your tires are the same age, so just deal with it. No, he'd be like, this doesn't make sense. Your alignment must be off. Maybe rotate this tire. Maybe get a new tire over here, but let's get everything back in the right position. Let's not just accept it for what it is and just do it have that for the rest of our life. That's not okay, right? And so I think we got to step back and say, listen, what are we currently doing when we hear the word arthritis in our spine? Are we doing something about it? Are we trying to correct it through chiropractic care? Are we taking annual or biannual x-rays? Are we doing our spinal rehab like we should? And if we're not, it's time that we get back on track with that, right? But listen, how do we combat arthritis? Is through chiropractic adjustments, spinal rehab at home, nutritional changes, and reducing stress in our life, right? And reducing toxins in our life. Those are the things that help us combat stress, right? Those are the things that help us combat stress. And reducing acidity in our environment. We're gonna go over that here in a second. But guys, I mean, I think if you look at just even the wobble cushion, like doing that on a daily basis is vital for your spine. It's absolutely vital for your spine. And so are you doing it? I'm going to post something on the Facebook group page, our wobble cushion worksheet. I would avoid the first exercise, though. I was looking at that just a little earlier. You'll see what I mean once you get it. But I am going to post the wobble cushion, some new wobble cushion exercises on there that just gets your spine moving, gets your joints moving. It's awesome. But those 3 different types of movements that we teach you in the office are to literally hydrate your joints, your tissues, your disc spaces. Your disc spaces can actually rehydrate themselves with the proper motion, right? And so make sure you're doing that. It's going to be huge. Guys, also, I mean, joint health. How do you help with healthy joints and reducing arthritis and helping with the chiropractic changes? Well, supplementation is awesome. Omegas, magnesium, curcumin. We have a joint health supplement that I absolutely love for not just my spine, but for my joints. People absolutely love this. It's a perfect blend of ingredients that is patented, that actually promotes cartilage growth and tissue regrowth. And so it's called Joint Health. Check it out in the office. But what's interesting is this is showing you how amazing our mind is before we get into some higher level nutrition. But just how important our mind is when it comes to joint health, is that there was a orthopedic surgeon who specialized in knees. And I think this is about 7 to 9 years ago, I want to say. He put out a study, and he did this study where he was doing tons of knee surgeries and he developed this new patent that he was doing, where it was like the most least invasive type of knee surgery, arthroscopic surgery. And he was getting such varied results on it. And he's like, listen, I'm just going to do a study on myself. I'm going to do it and all my patients. I'm going to do it for over 2 years of pre when they get the surgery and then after they get the surgery. And he published it, and it was incredible. And so what he said is this. He said, well, I took one group and I said, I did a real arthroscopic, 4 or 5 incision surgery on a knee with a similar injury, similar demographic, similar age, as another group where I actually did a fake knee surgery where I just put the incisions in. I didn't ever go inside their body. I just cut their incisions with a scalpel. The pre-game or the pre-surgery was all the same. The staff didn't even know any different. The healing, the post-surgery recovery was all the same. Staff didn't know any different. The rehab was all the same. No one knew any different. I mean, similar demographics, similar knee injury. And this is what's insane. After 2 years of watching them and studying them, he said there was actually no difference in outcome. And actually, that the people that actually never had the knee surgery over 5 years got way better results. It's called open label placebos. Look that one up. Open label placebos, where they literally will tell you that if you're going into a surgery, you may be part of the placebo study. You may never actually have to get the surgery, right? And so he kind of told on himself. He's like, this is crazy. People are actually getting better, and I didn't do anything to them. So look that one up. That's pretty interesting, right? Nothing that's going to damage our spine, cause bone spurring, disc space narrowing, is going to be eating sugar. Sugar will eat away at our bones. I mean, imagine that. Sugar causes so much acidity in our body that it eats away at our bones. Soda, guys, if you drink soda, and you guys just got to stop drinking soda. Throw away all the soda in your house. It's just horrible for you. Kids should not be drinking soda. Your spouse should not be drinking soda. It's just so bad. It is liquid poison. Dark soda specifically has carbonic acid in it, which actually brings down your blood pH, so you don't get sick from such a low an acidic pH entering your body. So carbonic acid is added to dark soda just so your blood pH is more acidic, which is insane. Also, there's phosphoric acid added to dark soda because it keeps us from throwing up the chemical cocktail that the soda is. So that's another reason why phosphoric acid is actually in soda. It's crazy. So soda causes like leaching of calcium from your bones to try to balance out pH in your body. And when you leach calcium from the bones, then you can get osteoporosis, osteoarthritis, bone spurring, other joint issues. It's just a huge mess. And so, guys, I mean, I think when we're talking about the spine, remember, hips must be even, shoulders must be even, spine must be straight. You must have 345-degree curves in the spine. The biggest thing that I've seen that helps the spine, outside of chiropractic, spinal rehab, eating clean, detoxing, good sleeping positions, is going to be extra movement, right? So walking every day, at least 40 to 60 minutes a day, is going to be huge for the health of your spine. Avoiding sitting, especially in poor ergonomic posture, it's going to be huge for your spine. But at the end of the day, like, who deserves to know what their spine looks like? I mean, everybody does, right? Everybody does. And I think it's unfortunate that a lot of people out there just don't listen. But I'd rather have them not listen than never know or never hear, right? It's kind of like if you talk to an evangelist or a pastor, they're always looking to tell somebody about Jesus, right? Or just to find the opportunity to be like, have a blessed day, or God bless you, or I'm praying for you, or let's pray together, right? And they're always looking for that opportunity. I feel like us as a team and chiropractic patients across the board are very similar to that. And they're like, hey, let me tell you about my chiropractor. Have you had your spine checked? Have you had x-rays taken? And a lot of times people will say, well, I've had x-rays taken of my spine. And my question is, what were they looking for? So if you have had their x-rays taken at a medical doctor's office, they're looking for fractures or pathology They're looking for needs for surgery, right? They're looking for crisis things, not for let's fix it so you actually can experience true health and healing things, right? And so, we have awesome opportunities for people to come into the clinic to get new patient appointments and x-rays. A lot of times people don't get their spine checks for two reasons. One, I don't have the time, and I don't have the money. Listen, guys, we have Patient Appreciation Week coming up next week where we do a discounted new patient exam, 100% donated to a local organization here in St. Louis. We always change up the organizations. And so if you're interested in that, just let the team know, and we can get anyone you love and care about plugged into the clinic. If you have family or friends that you notice need to be there and they're hard to communicate with, but they want us to reach out to them, we can absolutely do that. If you have kids or spouses at home and you're like, man, I know they need to come to the clinic, and you're like, I just don't know for time and money, I don't know anything like that. First step is just knowing what's happening first and then going forward from there, right? And so, guys, I know I covered a lot at you. I know I get heated about chiropractic. I also know that God needs no help to heal you. He just needs no interference. And one of the interferences is if it's in within your spine, you can't see it. Many times you can't feel it. We have to fix it, right? We have to fix it. And so, listen, you are designed to heal from the inside out. You were designed for that. You are fearfully and wonderfully made. But what happens over time when there's stresses in our life, this is the last demo, right? Last demo. I'm sure you guys love my demos tonight. What happens is this, is that when there's stresses in life, okay, imagine this is the nerves, okay? And there's things that tighten down on our nerves, right? There's stressors, there's chemicals from soda or crappy food, right? There's maybe I sit at a desk all day. I have an iPhone that I'm on all the time, right? And so there comes these stresses on our nerve roots, right? And yeah, this doesn't feel good, but very similar to the dime that I was sharing earlier, that if you just leave it there long enough, you just don't feel it anymore. You become kind of numb to it. And people say, well, I have to get adjusted for the rest of my life. Yeah, because we never want this to happen to you ever again. We don't want damage to your nervous system continuously to stay there day after day, month after month, year after year. Because you and your body deserve way better than that. But unfortunately, before you came to our office, this is what was happening in your life. So you do get adjusted for the rest of your life. Why? Because we want to make sure that we reduce this, regardless if you feel it or not, right? So you don't have tension on your spinal cord. So you don't have tension on your nerves. And with the slightest amount of tension, we remove it, and the body does one thing, and that's heal. So your brain can stay connected to your body at any given time at 100% or as close to 100% as possible. So guys, I love you. I love taking care of your spines. Let's keep rocking and rolling. We got an awesome one for tomorrow night. It's been next level nutrition, next level detoxification. You're going to want to take a lot of notes on that one. So have a great night. If you have any questions about tonight, specifically about chiropractic, how to get someone plugged into the clinic, how to do specific wobble cushion exercises, you'll see what I mean. We're here for you, right? All right. Bless you guys.